Good evening, everyone. Thanks for starting your week with us. I'm Janelle Slade. Well, tonight we begin with a topic that in some way or some form impacts everyone. Montana and Wyoming, both states filled with natural beauty, rugged history, and good people. But we also share a commonality that doesn't make us so proud. Per capita, our two states rank first and third for deaths by suicide. In both states, suicide is the second leading cause of death for people ages 10 to 44. And though the why may be hard to understand, what you need to know, 3 simple words can help save lives.
Nobody really wants to die. People want the pain to stop.
The most important message Dr. Eric Arzubi, a child and adult psychiatrist, wants the world to understand about suicide.
It's not that people don't want to live. A lot of them feel like they've exhausted every possible way of getting closer to having peace of mind, slowing down the thoughts that are sort of distressing and upsetting. Can't find relief, don't know how to find relief, and ultimately feel trapped.
The reasons run deep: childhood trauma, loss, genetics, isolation, risk factors, and mental health issues come from every direction and moment in life. Data shows while 12 million Americans have serious thoughts about suicide, nearly 48,000 complete it each year. And 2020 data reveals nearly 69% of Wyoming communities do not have enough mental health providers to serve residents. In Montana, that number jumps to 88%.
I hope that at least what we're trying to do is try to make it really easy to access mental health care, no matter where people are in Montana.
Frontier Psychiatry reaches beyond miles and borders and brings patients face to face with mental health experts in rural hospitals all across the state.
Too often it's really difficult, either because the resources aren't there, people aren't around, there's a long wait list.
If you're concerned about a friend, family member, or colleague, encourage them to seek professional help, whether that's texting, calling, or physically helping them reach that safety. But often, even before that step, help can begin with conversation.
Just ask them open-ended questions when you're talking with them. Don't say, oh, you're doing okay, right?
Megan Saunders knows suicide firsthand and now helps others cope with the loss and learn the tools.
And it might be scary, and that's okay, but just let them use their voice and tell you what's going on with them, because I think for so many people struggling with any sort of mental illness, all they want is a space to be heard and connected to.
And what happens, understandably so, is that a parent will respond and say, no, don't do that. You shouldn't do that. Your life is fine. Isn't your life fine? And what that closes the conversation right away, versus saying, tell me more, right? And by saying, tell me more, it opens up the conversation. Now, inside, we want to say, no, don't kill yourself. That's a bad idea. Stop it. But that's not necessarily what the person needs to hear at that moment. What they need to hear at that point is acceptance and empathy and curiosity. Tell me more.
3 words that could help save lives. If you or someone else is in crisis, text TALK to 741-741 or call 1-800-273-8255. Q2 is teaming up with the American Foundation for Suicide Prevention for this year's Yellowstone Valley Out of the Darkness Walk. It's this Sunday, September 19th at Will James Middle School here in Billings. You can register, it's free, learn more or donate by clicking into this story at KTVQ.com or going to afsp.org/Montana. Your donations truly help save lives. Those funds help spread preventative education and assistance to those in crisis.